I guess a plastic surgeon was working on his wife, and then we were told she went into cardiac arrest. It sounds like she went into several seizures. Right, it just is weird that it's the doctor and his wife. Oh, he was trying to kill her.
On November 28, 2023, a disturbing 911 call came into the Santa Rosa County Sheriff's Office.
Santa Rosa 911 police fire ambulance. I have an emergency. All right, who do you need? Police, fire, ambulance? Ambulance. We have an unstable patient. Okay, tell me the address. Hello? Hello? Ma'am, what's your address? Okay, are you there with the patient now? Yes. Okay, we do have help on the way. What exactly happened? She was having surgery. This is a plastic surgery office. And she's unstable, she's having seizures. I think.
Police and medical responders were dispatched to the Restore Plastic Surgery in Gulf Breeze, Florida. The situation on site was so serious and chaotic that a second staff member had also called 911.
Hold on, stop. I need one person to talk to me. What's a good callback number for you?
Please.
Okay, listen to me. I've got help. I've got help on the way. What's your name? All right, how old is the patient?
He is 32.
Okay. Is he breathing?
Nope, we're performing CPR right now.
Okay. All right. And you're doing, you said you got CPR going?
We're doing mouth-to-mouth going right now, yes sir.
Okay. Is there medical staff on scene?
Yeah, the doctor is on scene right now, but we need an ambulance to transport.
Okay, they're coming just as fast as they can, okay? Just continue doing your...
cardiac arrest.
I understand that. They're coming as fast as they can. They're coming with lights and siren, okay? Okay.
Throughout the call, you can overhear a man shouting in the background. This would later be identified as her husband, Dr. Benjamin Brown. When police arrived on scene, they discovered an unresponsive woman, identified as 32-year-old Hillary Brown. Some of the nurses at the clinic quickly informed police that the practicing doctor performing the operation was Hillary's husband, the same man heard shouting in the 911 call, Dr. Benjamin Brown. Performing surgeries on your own family members, let alone your wife, is not something most medical practitioners would do. This type of procedure had been done before on Hillary and was nothing out of the ordinary for her. The fact that there were other people as witnesses in the room had police confused as to how this case should be treated. A tragic accident or something far more sinister.
Just let me inform you, I guess. I don't see reason for more now, but basically we got a med call at a doctor's office here in Navarre where I guess a plastic surgeon was working on his wife, and then we were told she went into cardiac arrest. But I'm not sure she actually did. It sounds like there were other people present in doing this surgery, and it sounds like she went into several seizures, but I guess they were saying it really didn't look very good as to her. She wasn't doing very well when she left. But they did transport and everything. And I would say I would be a lot more like, uh-oh, if it was just him and her in the room, but there were some nurses that were present as well. So I'll just have him document it if that's cool with you. If you talk to Lance, just let him know, unless you think more should be done. Right, it just is weird that it's the doctor and his wife. You know what I mean? So, but like I said, he wasn't alone with her anyway during the procedure. There were other people assisting. So I guess Seville is going to just get all their names and do a quick info on it just in case something comes back where, you know, somebody says, oh, he was trying to kill her. You know.
EMTs transported Hillary to the hospital, having managed to restore her heartbeat. One of the nurses at the clinic would explain exactly how the situation evolved into Hillary going into cardiac arrest.
I was in there. We had finished the scar revision on her abdomen.
That was done.
Yeah,
all right,
that was done. She was up, walking around, perfectly fine. She was even mixing her own fat to transfer wherever she was doing it. He started to inject her lips with a numbing medication, which is typically lidocaine, epi, and sodium bicarb. He injected her left eye, She was talking about some blurriness, but her eye was swollen, so of course she couldn't see.
Yeah.
Injected the right eye, and that's when she started seizing shortly after the right injection started.
Okay. And did she go into cardiac arrest?
She seized for a few minutes,
Okay.
would stop, seize again. Each seizure probably lasting 3 to 4 minutes.
Okay.
Not grand mal, but pretty close.
Yeah.
What come out of it, she probably had a total of 4 or 5.
Okay. Before anyone could get working on her.
Yeah, I mean, we were blood pressure. I had a heart rate the whole time. Everything like that.
Okay.
During the procedure, was there anything unusual?
The fact that a husband was performing a medical procedure that left his wife in critical condition had police discussing the bizarre situation.
So where's the husband now?
He went
with you. With it? Okay.
He went with an ambulance.
Okay. Good. And was there cardiac arrest or no when you all got here?
Oh, yeah.
There was? Okay.
Yeah, he was doing CPR when we got in there.
The doctor was. Wow. Okay.
Anybody coming?
Ryan says probably not, but he wanted to call the captain. Couldn't get a hold of Lance, so he wanted to just run it by him. This is kind of new ground.
Right now, I told everybody go up front, just hang on, and we'll let them know.
Yeah, I can tell you right now.
Yeah, no, I'll do it. Okay. Doctor, he's a plastic surgeon. Husband. Procedure on his wife. It's called a scar evasion. There's a scar here, and they're doing 2 things around her eyes, too. They said they gave her a local anesthesia, and that's when she started going into seizures. She's done this many times before. They don't think that she's, so once you want nothing like that.
Right.
So it was like I said, they did get a heartbeat. She's back, and they were heading toward Sacred Heart.
Okay. You just let Lance know and if he wants to.
All right.
And how many people were present in the room when all this was going down?
Who else was in the room other than the doctor? Just you, ma'am? So,
She was shortly.
okay.
Yeah.
So it wasn't just...
Hillary Brown had been married to Benjamin Brown for only a couple of years. She had children from a previous relationship, and Ben would become a father to them. According to family members, Hillary was over the moon. She had finally found her special someone that she believed she could spend the rest of her life with. They lived in an incredible house, and Dr. Benjamin Brown would be recognized for his work in the plastic surgery field, winning awards. It wasn't long after they were married that Hillary began making comments to her parents about her appearance. She would also make comments that she was beginning to become unhappy in her marriage with Benjamin. Her parents assured her that she was beautiful and advised her that she didn't need to have any work done on her appearance. Hillary instead decided to have some procedures done on her face. And in only a short time, her appearance would be altered drastically, from this to this. In the 2 years that the couple were married, multiple cosmetic operations had been performed on Hillary. She had become so used to having this work done that she would even mix up her own lip filler and prepare her own IV bags before the procedures were carried out. Fast forward to the day that the 911 call was placed, with Hillary in a critical situation. EMTs had transported her to the Ascension Sacred Heart Emergency Care Department in Pensacola, Florida, where she would be in a coma, completely unresponsive. While Hillary sat in hospital on life support, her husband would post this to social media, begging Hillary to come back, stating that her heart came back, but her brain was not doing well. An employee at the Restore Plastic Surgery Clinic would make this statement to police. She claimed that she had only worked there for a few days and expressed that there was a lot of negligence in the office that led to Hillary going into cardiac arrest. Nurses had claimed again that she had prepared some of the equipment herself before the procedure was carried out. Not only that, but she had taken a plethora of pills before the procedure, which would later be identified as Valium and several other anti-pain medications. One employee at the clinic would claim that she had been convulsing and having seizures for 10 to 15 minutes before 911 was called. Dr. Brown seemingly had a history of unsafe practice, with another bad procedure not reported to authorities. A week after Benjamin Brown had performed the surgery on his wife, She would pass away at the hospital, having been in a coma and connected to life support at the Ascension Sacred Heart Emergency Care Department. Police at the time would release this statement, claiming they had to wait for the results of an autopsy, which could take months. Further information would come to light about how the procedure was carried out and what was used on the day Hillary died. She had prepared her own tumescent solution, which included several chemicals, and filled IV bags with the prepared solution before she would take her cocktail of pills. When she went in to have the procedure done, her husband, Dr. Brown, would give her additional anesthesia without checking if she had taken anything previously. He would also fail to record the dosages and times that he gave the anesthetic, seemingly pumping her with unregulated amounts. The first part of the procedure began, which was liposuction on Hillary's arms, and she would begin experiencing twitching. After that, she would begin experiencing blurred vision and was making comments that she was seeing orange. A deeply disturbing fact would then come out that Hillary had assisted in her own procedure by suturing the skin back together. This meant that she had actively stitched herself back together, the thought of which would make most people's skin crawl. After a short break, Dr. Brown would return to find his wife complaining of blurred vision and experiencing muscle twitching, which is a sign of lidocaine toxicity. Instead of seeking help, he instead decided to continue the lip procedure by putting more lidocaine into Hillary's body. It wasn't long after this that she became unresponsive. This is when chaos erupted at the Restore Plastic Surgery Clinic, with Dr. Brown having no idea what medication his wife had taken, a failure of his professional medical standard. The story had begun to hit the local news, and witness accounts would start coming out from ex-patients of Dr. Brown, claiming they had endured terrible procedures. Some of them would provide photos to the media that are simply too graphic for YouTube, showing severe infections that wouldn't heal, causing permanent scarring and lifelong injuries. Another patient even claimed that Dr. Brown had asked her if she wanted a Brazilian butt lift, known as a BBL. When she declined, he would go ahead and perform the procedure anyway, which resulted in severe side effects for the patient. Another patient had claimed that Benjamin's wife Hillary had performed facial laser surgery on her when she wasn't licensed to carry out any medical procedures and had no formal training whatsoever. Several of these patients had filed complaints with the Florida Department of Health, but no action appeared to have ever been taken against Dr. Brown. Another story would surface of a husband whose wife had gone in to get a procedure done only weeks after Hillary's death and would pass away only days after the procedure. When the husband placed the blame on Dr. Benjamin Brown, he would deny it, and no proof was ever found the procedure he carried out was what caused her to die. The husband had no doubt in his mind that his wife, who was in perfect health before the procedure, had somehow succumbed to something that happened during the surgery. Several patients would look at their legal options to take Dr. Brown to court, but they were devastated to find that he only had minimal insurance coverage. To add to that, he had all of his patients sign a waiver that absolved him from any responsibility of botched medical procedures, creating a legal loophole that he used to escape legal action. With all of these stories being made public, the Florida Department of Health had no choice but to issue an emergency restriction of Dr. Brown's medical license. The results of the autopsy would eventually come out, which would show that Hillary had died from complications from lidocaine toxicity. On June 14, 2024, a judge signed off on a warrant for the arrest of Benjamin Brown. 3 days after the warrant was issued, he would turn himself in to police. He was charged with second-degree felony homicide, manslaughter by culpable negligence. This was related to his choice to delay calling 911 for up to 15 minutes in relation to a serious medical emergency. On the same day he was arrested, he appeared in front of a judge and was bailed out on a $50,000 bond. He entered a written plea of not guilty to the second-degree felony homicide charge against him. His court case is continually getting pushed back due to the defense and prosecution requiring more time to prepare their cases. Since his arrest, Dr. Benjamin Brown listed his lavish Gulf Breeze, Florida house for a cool $2.5 million, which recently sold. The doctor also recently renewed his medical license for another 2 years. This is a seemingly optimistic move considering it's restricted by the Florida Department of Health over complaints about botched surgeries, infections, and unauthorized Brazilian butt lifts. Only a week after his wife had passed, he listed this advert on Facebook Marketplace selling some ski boots, claiming it was because his wife didn't ski anymore. A positive to come out of this tragic story is that Hillary's Law has been proposed in Florida, with the bill aiming to improve office surgery standards. The bill seeks to prohibit physicians from performing surgery on their own family members, require inspections of doctors' offices, and ensure that trained medical staff are present during surgical procedures performed outside a hospital.
You know, that's my daughter laying there lifeless. Tubes, wires everywhere. Her eyes partially open, just in a glazed stare. And so, you know, I asked, what happened? And his response was, I don't know. Well, I mean, I didn't come out right at first just because my daughter passed away, you know, pointing fingers and thinking this guy's guilty. I gave him all the opportunity. For 7 days, I sit in a hospital room, watch my daughter die. You know, I watch her brain swell. I watch her take her last breath. And we're sitting in the same room together. There was a lot of conversation there, a lot of opportunity to come clean and just say, I screwed up. You know, I never got that. I hope she is his last patient. I want to have that. This is my daughter, Tanner. This is all I got to remember by.
As of the time of making this video, Dr. Benjamin Brown is still waiting to face his day in court, but is currently free to live his life amongst the public. If he is convicted, he faces life in prison and a fine of $10,000. A combination of negligence, complacency, and ignorance created a situation where a beautiful young lady was taken far too soon. If you found this case compelling, help us out by liking the video and subscribing to the channel so you don't miss our next deep dive into shocking true crime cases. Channel memberships with extended perks, such as members-only videos or early video releases, are also available by hitting the join button. And as always, thanks for watching, and we'll see you in our next video. Take care, everybody.